You know, I think most of us assume something pretty simple. Good management equals good performance. Seems logical.
Right. It makes intuitive sense.
But then you think about hospitals. Incredibly complex places, right? Life and death decisions. Does that simple equation still hold up? Does good hospital management really mean better patient care? It seems like it should, but is it that clear cut?
Well, that's exactly what we're digging into today, this whole relationship between how hospitals are managed and the actual quality of care patients receive.
Okay.
And we're basing this deep dive on some really solid ground, a huge global systematic review. It just came out in Health Policy and Planning 2025.
Global review. So lots of data.
Massive amount. They synthesized evidence from over 11,000 articles, so it gives us probably the clearest global picture we've ever had on this.
Wow, okay. So our mission here is to unpack what all that evidence tells us. We're looking for the surprises, the practical stuff, what it all means for you listening, whether you work in healthcare or just want to understand what makes a good hospital tick.
Ex-
All right, 11,000 articles. That's a mountain. What's
Yeah.
the headline finding? Did it just confirm our gut feeling? Good management, better care?
Actually, no. The big picture finding is, well, it's mixed.
Mixed. How so?
So they looked at 111 different associations across 25 studies,
Mm,
and get this, almost exactly half, 49.5%, showed a significant positive link. Management good, quality good.
okay, sounds about right.
But almost the exact same number, another 49.5%, showed no association at all, just
Mm.
nothing.
No link. That's surprising.
It is. And only a tiny fraction, like 1%, found a negative link. It really shows that management isn't just one thing. It's HR, it's performance tracking, target setting, lots of different pieces.
Right. So the overall picture is murky, but I bet it gets clear when you start breaking down quality of care itself. Did you see stronger links in specific areas?
Absolutely. That's where things get really interesting. When you look at structural quality, basics like having enough drugs, the right equipment, enough staff.
Foundations.
Exactly. The link there was really strong. A huge 79% of those associations were positive.
Okay, that makes sense. What about clinical practice?
Yeah, clinical quality. So our staff following the guidelines, the best practices, still a solid majority there. 60% positive associations.
Good. And health outcomes, like people actually getting better.
Also, mostly positive. Things like
Mm.
mortality, morbidity.
Mm.
57% showed positive links with management practices. So management definitely seems to matter for those core clinical and resource aspects.
Okay, that paints a more positive picture for the core functions. But you hinted there was a big surprise somewhere. Where did things not line up?
Right. This was the real standout finding, I think, when it came to patient satisfaction or just their general experience of care.
Yeah.
An overwhelming 80% of the associations with management practices were null. Basically, no connection found in most studies.
80% null. Wow. Why would that be?
Well, the review suggests a couple of things. Maybe hospital management focuses more on the clinical nuts and bolts, the efficiency, the outcomes we just talked about, and less on the sort of subjective patient journey.
Hmm.
Plus, measuring patient satisfaction is tricky. Surveys can have biases. People's expectations vary wildly.
Mm.
Think about different countries, different baseline expectations. Someone might rate basic care very highly if their expectations are low.
It makes sense. It does raise a question, though, with these mixed results, and especially that null finding for patient experience. How solid is this evidence overall?
That's a really important point to consider. Most of the studies in the review were observational, cross-sectional snapshots mostly.
Meaning not experiments where they changed management and watched what happened?
Exactly. Not intervention studies, like a randomized trial.
Yeah.
So you can't be totally certain about cause and effect. There's what researchers call a risk of bias.
Okay.
And here's a weird twist. The studies judged to have a serious risk of bias actually reported more positive links, 61%, than the ones with only moderate risk, which was 45%.
Wait, the more biased studies showed a stronger positive link? That seems backwards.
It does. It just highlights how complex this is and how hard it is to measure management practices quantitatively and link them definitively to outcomes without that risk of bias creeping in.
So, pulling this all together,
Hmm.
what's the takeaway for people running hospitals, making policy, or even just for us as patients? What does it mean?
Well, I think the big positive is that it shows hospital management can be evaluated systematically. That's a step.
Right.
And the findings, particularly around clinical quality and outcomes being linked, even if imperfectly, suggest it's worth digging deeper.
Yeah.
We definitely need more rigorous studies, those intervention trials, ideally randomized controlled trials, to really pin down cause and effect.
Okay, so the bottom line seems to be Good management likely does boost the core stuff resources following clinical rules. But the connection to how happy patients feel about their care, much fuzzier.
That sums it up pretty well. It suggests improving management isn't some magic wand for everything. It really forces us to think strategically. Where and how can management changes make the biggest, most meaningful difference to patient health? And maybe makes you wonder what aspects of hospital management actually shape your view of healthcare quality.